Hello, from speaking with you in the group conversations, I found out that the following problem needs clarification and discussion. Why the cause of chronic fatigue is so misunderstood? Understanding the cause of chronic fatigue syndrome has always been very difficult. When a specific point in the body or area was blamed for the symptoms, then most of the time therapies didn't work out. So either it was the understanding of the cause or the therapeutic approach that was wrong. Then it started a pattern of shifting the blame, so removing the problem of chronic fatigue from a physical problem to one that is mental, psychological, which is not the case. It is clear now that all the mental health problems are derived from the fear, the frustration and the challenges that occur when a person suffers the symptoms of chronic fatigue. Neither they solve paradoxes like sleep that is not refreshing, sleep that doesn't make you feel better and rested. So, not knowing the cause, you're facing challenges like sleep issues and pain and fatigue without understanding why they occur. You fear, when is it going to end? Can I cope with it? And then the frustration because you know you were a completely different person before this happened to you, and you cannot understand how to get back to where you were. It is exactly for these reasons that I decided to film this video and share them with you, because this situation is unacceptable, it is not fair, and there is a way out. Before I go any further, please allow me to introduce myself. I'm Tommaso Perego, a herbalist, a naturopath, nutritionist and iridologist, and I'm a senior lecturer at university. So we care about the cause, but we care even more for a good therapy. A successful therapy should be designed to make you thrive. It should be produce no harm, cause no vicious cycles, and it should be based on an effective, clear diagnostic. Diagnostic means understanding in a clear, simplest way the mechanism underlying the appearances of the symptoms of chronic fatigue syndrome. Means unraveling without technicalities the symptomatic appearances of fatigue, pain, exhaustion, tiredness. So what is this simple, clear diagnostic? Fluids of our body, the extracellular matrix, the interstitial fluid, the fluid that surrounds our tissues, our organs, the fluids that enrich our body, that runs through the lymphatics and our veins. They are at the basis of chronic fatigue syndrome. Problems with fluids of our body means we have problem with the communication between the different parts of our body, for example, between nerves and muscles, because we know the nerves deliver communication through the fluids, neurotransmitters, hormones, travels via fluids. We have problem of nourishment, so the necessary food and nutrition doesn't arrive to the cell properly. We have problem with drainage, so the clearance of waste and toxins from the very fluids and the blood. And then we have problem with pain. We lack buffer that protects us from inflammation and acidity, and we have a poor delivery of the immune system. The type of problems are, for example, lack of movement, stagnation, meaning that the fluids don't circulate properly, so nourishment doesn't reach with the same frequency, toxins don't get eliminated with the right rate, so they stay there and increase the risk of inflammation. There's not enough fluids to protect, and so the immune system has a poor delivery, and pain ensue because membranes are not protected. Problems with fluids produce the following symptoms. Pain, located mostly anywhere, so it could be in the form of headache, gastrointestinal problem, back pain, leg pain, muscle pain. They create what is called autonomic dysfunction, so poor communication. They create brain fog, and they create tiredness and exhaustion. Isn't it shocking that most of the symptoms that I just mentioned, the problems of the fluids and the symptoms arising from problems with the fluids in our body, are actually the same as the chronic fatigue syndrome symptoms. So why the cause is so misunderstood? Well, the extracellular matrix and the fluids of our body have been studied, and their function, crucial in the mechanism of the body health, has been investigated and described thoroughly. However, this knowledge didn't enter therapeutic practice, so it is not applied in chronic fatigue syndrome and basically never applied because in general doctors are not trained in them. So only therapies that are intrinsically holistic are able to act on the fluids, are able to not create any side effects and further intoxication, and be gentle but deeply cleansing, and herbal medicine is one of these therapies. So, to recap, in this video we talk about fluids, and fluids that are everywhere in our body, surrounding all our tissues and our organs. The extracellular matrix, the fluid that surrounds our tissues, our organs, the fluids that enrich our body, that runs through the lymphatics and our veins. They are at the basis of chronic fatigue syndrome. When problems arise with our fluids, we experience symptoms of pain, of tiredness, of fatigue. Symptoms are not local accidents, but they appear in response to the fluid's dynamic. So choose the right therapy, holistic, to transform and reorganize your fluids. I hope this video was useful. If you want to know more about how to treat the fluids, please click the link at the bottom. Thank you.